Monday I had day 6 of placement, so I thought I could tell you about it today. Okay, so in the morning I spent some time ringing some clients, so some patients who have had treatment and need some aftercare. So after radiotherapy or chemotherapy, we, the speech therapy team, often ring patients to see how they're getting on. So they might have had swallowing and communication problems, so we're ringing to check up and see how they're getting on now, and if they haven't had any swallowing or communication issues, then maybe checking to see if anything has developed and whether they need any input now. So one of my aims, as I said about in my last video, I think placement 5, was to develop my collaboration skills, and obviously that's to do with patients as well. I wanted to make sure that I had phoned a patient by the end of placement, because that's not really something I had any experience in, and I find the phone really daunting. I don't know if anyone else has this, but I just don't really like talking on the phone, especially with people that I don't know. So I wanted to kind of get that ticked off and make sure that I am developing those skills now. I phoned up a lady who had, I think she'd had a glossectomy, and we were just checking on how she was getting on. So on the wards when we were seeing her as an inpatient, she had had some trouble swallowing, and just checking up on what she's eating now, and if she's asking any questions, giving the best answer that I could. So she was asking whether she should be trying to eat and drink, and I obviously suggested that she should, and that she should be trying to have as much as she can to get that range of movement back. I also phoned a gentleman who had had radiotherapy. I was asking him whether his speech or swallowing had changed, or what he was eating now. So when he was on radiotherapy, I think he was on a soft diet, but whether he was keeping up with that, whether he was getting all the nutrition he needed. Also, I was asking him about exercises, so we tell people to keep up with their exercises that they're doing, because that really helps with the range of movement and the muscles in the mouth for swallowing. So he said that he was fine with all of the exercises, he was doing them every day. He said that he was having some trouble with dry mouth, which is really common after radiotherapy because it kind of zaps all of the mucous membranes, so you don't get as much mucus as you need to sometimes for swallowing. And we kind of suggest that people who have a dry mouth and trouble getting mucus do something with, it's called like a steam something or other. It's like when you have a cold and you need to clear your sinuses, similar to that. So a bowl of warm water, so just out of the kettle but not boiling because you don't want it to scald you, and just head over a bowl with a towel, and that kind of releases and moistens things up a little bit, so that sometimes helps. After that we went downstairs to the clinic, and there was a man who needed a valve change. Usually with valves you get them changed about 4 months. Every 4 months is usually the cut-off point, because they start to kind of deteriorate and they kind of lose their function after that amount of time. So his had actually been in for 6 months, and I think he'd reported that he'd been coughing and that he'd felt stuff going down the wrong way, and that's kind of not surprising because he probably should have come and got it changed a bit earlier. So we took that out and replaced it with a new valve. That should last him another 4 months, and that's just the process that I have explained before about putting a new valve in so that he can voice. Now the afternoon was really exciting. My PE had arranged to go to a sister hospital of Brighton, so we went to the Princess Royal, which is in Haywards Heath, and she had been asked to go there to do a FEES. So a FEES is something that we use as an assessment of a swallow. So it stands for fibre optic endoscopic exam of swallowing. is a mouthful. It's kind of like a stick with a camera on the end of it, and you put this up somebody's nose and down just above the vocal cords, so you are able to see when somebody is eating and drinking what is happening at this level here. So that's really useful because you can't see that part of somebody's body just by looking at them. You also could use a video fluoroscopy, but it's really good to see like 3D and in colour what's happening, and it's kind of live, so the patient is there eating and drinking whilst you watch. So it is really cool and really useful to see. So the gentleman we saw on the ward was a gentleman who had quadriplegia, so he didn't have any use of his legs or his arms. I think that's due to brain injury. We didn't actually look at his file very much beforehand, so I don't actually know his proper diagnosis, but I'm guessing it's due to brain injury. He was able to communicate by nodding, and he could understand simple instructions, so that was really useful for when we were doing the assessment. He could understand what we were doing quite well, which was nice. His wife was there when we arrived, so we did ask her to leave just because there would be so many people in the room already. There was me, my PE, the speech therapist who works at Princess Royal, her assistant, and then a nurse as well. So quite a few people in the room with him already, so we didn't want to add anybody else to that to make it a distraction. We put the fibre optic stick basically down his nose, and it was amazing. You could see on the computer screen all of his, all inside his vocal tract up until his vocal folds. So that was really cool, and to make it even easier to see what's happening, you put some blue dye in whatever you're feeding him. So we had water, so we put some blue dye, like food colouring, into the water, so when he had a sip you could see if any water was pooling around the vocal folds, whether anything was going down into his trachea. We also fed him some ice cream as well, so just cautious trials just to see what he could manage. And we did see there's something called the folliculi. So folliculi, I don't know. The water and the ice cream were pooling around his folliculi, so it was a bit risky because there was so much residue. There was some residue on his epiglottis, the flap that comes over to protect the airway, so if there's lots of residue on it, it might make its way down near the vocal folds and then into his lungs, so it's very risky. So that's kind of what we got from that assessment, that we wouldn't have been able to see just from doing a normal swallow assessment on him. My PE and the other speech therapist at Princess Royal wrote up his notes whilst we went and got his wife. The reason my PE was called to go and do that assessment is because she's one of the only people in Brighton who has those competencies to do the FEES assessment. So you have to work your way up to getting competencies. So for swallowing, to do a video fluoroscopy, you have to prove that you're capable of doing that first, and the same with FEES. So you have to call somebody in who has those competencies if you don't. So that's why she was called. We went back to the hospital, and by that time it was nearly time to go home. We ended up for the last hour or so just doing some more of that audit that I was talking about last week, so inputting data onto an Excel sheet, and we actually nearly finished. So yeah, it was a bit of a weird one this week. We didn't really spend any time on the wards. I spent most of my time journeying with my practice educator and then doing the FEES. But because I hadn't seen a FEES before, it was really interesting to see, and it was really cool to just see a different way of assessing somebody. I think that's it. I will keep you updated with what I'm doing. I think I've got 2 weeks left now, so not long. Remember to like the video if you liked it, and subscribe if you want to keep up to date with what I'm doing. Yeah, see you soon. Bye.